Good day, everyone. My name is Catalina Silvera, and I am going to tackle about the nursing care of the pregnant client. First trimester. The first trimester of pregnancy is counted from the first day of your last period through to week 12. It is also the most crucial to your baby's development. During a period, your baby's body structure and organ systems is magdevelop na. So, why are trimesters important in pregnancy? It is to understand the milestone of each trimester of pregnancy and navigate the development of your baby. The next is to know what are the possible complications and pre-existing illness at the time of each trimester. So, aning ako time, important ang first trimester, ang trimester nga mabalaan nimo para makaibaw ka kung unsang mga possible nga complications nga moabot para aware na kaanadaan aron dili na ka maglisod ug unsay imong buhaton. Common psychosocial changes that occur with pregnancy. Psychosocial change. First trimester task accepting the pregnancy. Women and partner both spend time recovering from shock of learning they are pregnant and concentrate on what it feels like to be pregnant. A common reaction is ambivalence or feeling both pleased and not pleased about the pregnancy. What to expect in first term pregnancy? Your body. Swollen and tender breast. Ang imong nipple is gahi. Then, nausea with or without vomiting. Malipong ka whether masuka ka or dili. Then, increased urination. Sige kag ihi. Then, fatigue. Food cravings and aversions. Heat burn, constipation. And then about your emotions, feeling delighted, anxious, exhilarated, exhausted, or thrilled. First trimester pregnancy. The first trimester is counted from the first day of a woman's last period, although she is not pregnant until ovulation, which typically happens mid cycle. This is from week 1 to 12. The first month to third month. What to avoid during the first trimester? The litter bugs. Cat feces can harbor a potentially harmful parasite that can cause an infection called toxoplasmosis. Hot tubs and saunas. Most dangerous during the first trimester, whereas the fetal parts are made during this period. This is the time the baby is most susceptible to birth defects. Alcohol. There's no amount of alcohol that's been shown to be safe during pregnancy. Alcohol can cause complications such as fetal alcohol syndrome or FAS. Raw or undercooked foods. Raw and undercooked meat, seafood, and eggs can harbor infection, causing bacteria and parasites that aren't good for you or your baby. Cigarettes and marijuana use. Smoking cigarettes can increase the risk of pregnancy complications like low birth weight and early delivery, as might smoking or ingesting marijuana. So, dapat jud avoid ang smoking kay makaada siya complication like low birth weight and early delivery. Like kanang mga mother nga uban maahat og anak og sayo. Like 7 months pa lang yung anak. So, dapat ang mga bawal during this trimester is dapat dili nato buhaton. How much does a baby grow in the first trimester? Baby bones. By about week 6, baby starts to sprout arms, legs, hands, and feet, and finger and toes around week 10. So, s- sa week 6, nagsugod na og kanang tubo or develop ang mga parts sa bata like arms, legs, hands and feet, fingers and toes around week 10. And then hair and nails, skin begins forming between week 5 and 8 with hair follicles and nail beds forming around week 11. Digestive system, by about week 8, baby's intestines will begin forming, and your baby will have already gone through 2 sets of kidneys, with the third and final set on its way. Sense of touch. Your baby will develop touch receptors in the face, mostly lips and nose. Around week 8, by week 12, the receptors will have sprung up on the genitals, palms, and the soles of the feet. Eyesight, optic nerves, which pass into from the eyes to the brain and back, and lenses begin to form by week 4, with the retina beginning to form around week 8. So, magkadanag sense of sight ang baby. Heart, by week 5, the tube that will become your baby's heart begins to beat spontaneously. It will become stronger and more regular, and you'll be able to hear it around week 9 or 10, though sometimes later depending on your baby's position in your uterus. Brain, by about week 8 of pregnancy, your baby's brain will be wiggling those developing limbs. Sense of taste. Your baby will have developed taste buds that connect to the brain by about week 8, but because the taste pores are still under construction, the baby won't be able to taste the surrounding amniotic fluid, which, by the way, tastes like your most recent meal, like sa imong mga gipangaon. First trimester symptoms. Morning sickness. Unfortunately, it doesn't just strike in the morning, and it typically starts up by about week 6 of pregnancy. Ginger tea or drops might help, as can small but frequent meals. If it's served, you might want to consider talking to your doctor about medications to treat the symptoms of pregnancy related nausea. Tender breast, so tender, so tingly, and so big. You might be wondering where your old boobs went by about week 6. So, ang tutuyan is mo kahi, mo dako, and pagkuan masakit. Mood swings. You may or may not fell up then down, then up again by week 7. If you have a history of depression or think it might be more serious, talk to your doctor about getting screened for prenatal depression. Weight gain or lack thereof. Your baby is still very small, which means all told you only need to gain about 3 to 4 pounds in your first trimester. And then, you might continue activities of daily living but do not lift anything greater than 20 pounds and avoid recreational activities. So, avoid nimo mag-arsa-arsa og mga bugat nga mga butang o magbuhat-buhat og mga activities like mga activities nga kusog mag-consume og energy. Avoid sexual activities in first and last trimester. So, if ang mother is nakabalo na nga burod na siya, so i-avoid na nila sa ilang partner na magbuhat og sexual intercourse. Avoid returning to work if it involves more than 40 hours or a week, night shifts, prolonged standing, or heavy physical work. Rest in the left side lying position to improve blood flow to the uterus. Consume adequate fluids. Notify your healthcare practitioner if signs symptoms are observed. Keep appointments for prenatal care. Timetable for physiologic changes of pregnancy. Location of change in the circulatory system in the first trimester. Blood volume increasing, pseudoanemia. Ovary clotting factors increasing. Uterus. Corpus luteum active. Increased growth. Cervix. Softening progressive. Vagina. White discharge present. Musculoskeletal system. Pigmentation. Maternal glomerular filtration rate increasing. Kidney. Aldosterone increased. Retaining sodium and fluid. Gastrointestinal system. Thyroid. Increased metabolic rate. Summary of primary causes of bleeding during pregnancy. In the first trimester, type treated miscarriage, early under 16 weeks, late 16 to 24 weeks, imminent or inevitable miscarriage, or missed miscarriage. Ang cause is unknown, possibly chromosomal uterine abnormalities. And the assessment is a vaginal spotting, perhaps slight cramping, or vaginal spotting, cramping, cervical dilatation, vaginal spotting, perhaps slight cramping, no apparent loss of pregnancy. Cautions. Disseminated intravascular coagulation associated with missed miscarriage. And the type, incomplete miscarriage, vaginal spotting, cramping, cervical dilation, but incomplete expulsion of uterine contents. Complete miscarriage, vaginal spotting, cramping, cervical dilation, and complete expulsion of uterine contents. Time first trimester. Type ectopic or tubal pregnancy. Cause implantation of zygote at site other than in uterus. Tubal constricture, adhesions associated. Assessment sudden unilateral lower abdominal quadrant pain, minimal vaginal bleeding, possible signs of shock or hemorrhage. Cautions may have repeat ectopic pregnancy in future if tubal scanning is bilateral. Hyperemesis gravidarum or severe vomiting. This is a condition characterized by severe nausea, vomiting, weight loss, and electrolyte disturbance. Mild cases are treated with dietary changes, rest, and antacids. Nursing diagnosis. Altered nutrition, less than body requirements related to nausea or dry heaves. Expected outcomes. Patient will show no evidence of nausea and or dry heaves and exhibit adequate intake of appropriate nourishment and satisfactory weight gain for first trimester, about 1.4 kilograms or 3 lb. Nursing interventions or rationales. Take a 24-hour diet history and discuss patterns and incidents to identify probable causes of nausea. Discuss eliminating nausea producing foods, eating small, frequent meals, avoiding an empty stomach, eating dry carbohydrate substances such as crackers on awakening followed by fluids such as hot tea or coffee within an hour. Ceasing smoking and improving posture anyways to decrease feelings of nausea. Instruct patient about hyperemesis gravidarum or severe vomiting and have her report any episode of severe vomiting to assess an early detection of complications. Severe miscarriage and abortion. A miscarriage is the loss of a baby before the 20th week of pregnancy. The medical term for a miscarriage is spontaneous abortion. but it isn't an abortion in the common meaning of the term. Molar pregnancy. A molar pregnancy occurs as a result of an abnormal development of cells in the placenta that cannot support a growing embryo. Molar pregnancies are caused by chromosomal abnormalities in the sperm that fertilizes the egg, or both. As you can see in the structure below, there is a difference between the normal pregnancy and the molar pregnancy. Is because sa molar pregnancy nagkaada og complications na nagresult sa abnormal development of cells in the placenta. Ectopic pregnancy. This occurs when the implantation occurs outside of the uterine cavity where it is supposed to be. In most cases, implantation rather occurs in the fallopian tube. An ectopic pregnancy is an emergency and must be dealt with quickly. Case signs to look out for are lower abdomen pain on either side, a sudden onset of cramping and possibly fainting, repeated periods of severe abdominal pain, vaginal bleeding, increased urinary frequency with a burning sensation, multiple missed periods, and a fever. Nursing interventions to ectopic pregnancy. Inform the patient of the current situation. Advise to have ultrasound. Always check the vital signs. Evaluate the couple's informational needs. Provide post-operative care. The nursing interventions to molar pregnancy. Nursing assessment. Assess the abdominal birth of the pregnant woman to check if it is within the usual landmark of pregnancy. Assess for signs and symptoms of pregnancy-induced hypertension. Because for a woman with each mole, they occur earlier than the 20th week of pregnancy. Instruct the woman to save all perineal pads containing any clots or tissue that has passed out of her during bleeding.